Thank you so much, Jeannie, for the kind introduction. And thank you very much for everybody to come here today. We're super excited about being able to present some of the work that we've been working on over the last few years. And Flo is going to take it from here. We're going to talk about stigma, HIV stigma, disclosure, and criminalization and access to care. And really, you will see like lots of these issues are really, really closely connected for many women living with HIV here in Metro Vancouver. Flo is going to take it from here, and I think she's going to do also acknowledge the territories that we're on today. And we're also going to try and coordinate our...
Is this working?
Oh, yes, our microphones.
Fancy. Hi, everybody. Good afternoon. And like Jeannie so nicely acknowledged the land, I too, doing our presentations everywhere that we do go, we want to acknowledge always Musqueam, Squamish, and Tsleil-Waututh Nation. And I just want to take a moment of silence to remember there are 30 SHAWNA participants who have passed on to the spirit world. Don't mind taking a moment. Thank you. So just to give a little bit of background about the SHAWNA Project. So it was launched in April of 2015. So we're well into our 4th year of this community-based research. It's a longitudinal study with cis and trans women living with HIV. And we worked around their policy, legal, and the gaps and barriers in health with the women living with HIV and their HIV care. So I think it was in, it would have been early 2015 when the team of SHAWNA went and did community focus groups. When we first had actually Positive Women's Network and that, we had a big group in there, and I got to be present with that too. And they came to ask us what we wanted to be in that quantitative interview, what questions we felt were really needed, and what was the barriers and gaps for us. And that's how the quantitative part of SHAWNA study was kind of created. We also had HIV service providers, other AIDS service organizations also with their input into our interview guide. We also, so when a woman comes into SHAWNA, she does her first baseline interview, and then there's a follow-up with that same woman for every 6 months for the past 4 years. They also see a nurse practitioner, get their viral load, they're tested for STI, any kind of infectious diseases. And the other part of our SHAWNA study is the qualitative research, which we've actually, me and Lulu got trained in to do. And we've had about 80 to 90 participants in that part of the SHAWNA study with the qualitative and arts-based. One important thing that I love about SHAWNA since the launch of April, we were hired before the launch as peer researchers, and we were trained in to be the ones who went out to do recruitment for women as peers and stuff, making it a lot more easier for women. We did lots of presentations to like over 300 organizations in the Metro Vancouver area. And this next picture, I don't want to forget these ones because our SHAWNA Positive Women's Advisory Board was developed in June 2015, and we've been meeting quarterly with them for over the past 4 years. And you can see those happy little faces from women right across Metro Vancouver, all the way from Fraser Valley, Abbotsford, Chilliwack, right from like North Vancouver also. So I'm now going to pass it on to Lulu. She's going to go over the demographics of our SHAWNA findings.
Thank you. Is this thing on? I don't think it's working. Thank you so much, Flo. Since the beginning of the study, we now have 330 plus participants living with HIV who access their health care here in the Metro Vancouver area. And the age range of the participants start at 22 and go to the age of 68, which makes the median age range 44, which leaves 25% of the participants being 50 years or older, and the 40 to 49 years of age is 40% of the study, and 30 to 39% of the age make up 26% of the study. When we break down the percentages of the ethnicities of the participants of the project, it looks like the following that are listed. 57% are Indigenous, 34% are white, 5% are African, Caribbean, Black, and 4% are Asian, Middle Eastern, or other, identifies other ethnicities. And in our findings, we found that 82% of the participants parented or have given birth, while 93% is currently supporting one or more dependents, such as children, partners, and other family members. What we found for how the percentages of participants identified their sexuality and gender identity follow as 23% for their sexual orientation and 11% identify as trans or two-spirited. 71% reside in the city of Vancouver. And following that, 11% live in Surrey, while 7% of our participants do live outside of the Metro Vancouver area. And altogether, 91% of our SHAWNA participants access their HIV health care within the city of Vancouver. We also asked questions around what stigma and discrimination our participants have experienced, and these percentages reflect those experiences. With 97% experience HIV stigma in their lifetime, which could be seen from having to disclose their status with people they are not sure they can trust, negative social attitudes and negative feelings and ideas and how they feel living with having HIV. When the participants were asked what they would like to see put into place, that would help them have the ability to adhere to their ARVs, this is what most of the participants had said. For 24%, they would like to see better access to food. With 22%, they would love to have better housing. 22% also would like to have help with their addictions, and 20% would like to see more peer support put into place. 18% would like to have transportation support, whether that be for picking up medications, having medications delivered, those kinds of things. And 15% would like to see more financial supports put into place, while 13% would like to have more trauma and counseling support. Now I'd like to pass it off to Flo so she can tell us more about trauma-informed care.
Thanks, Lulu. Yeah. My mic still on? Yeah. I'm unmuted. So the trauma-informed care for women living with HIV in our SHAWNA study, it's pretty, I can't really see the number there. I'm blind, sorry. 95% of SHAWNA participants have experienced physical, emotional, and sexual abuse. Like that's almost our entire 340 women, 330 plus women. So 97% of them. Also, like our, 31% of SHAWNA participants. Oh, I'm sorry, I apologize. I have really bad eyes. These are your 50s. No, just kidding. In regards to, I guess, adherence, and this is a personal part for me too, because trauma-informed care is so important for so many of my peers in the SHAWNA study. And I do have my own viral load that I'm going to show you in regards to my traumas that I have experienced. And it's this one. So you can see my viral load from basically 2008 to about 2015 when I finally started to adhere to my meds in the middle of 2014 to 2015. So it's about just 5-6 years ago But, and you can see all my vacations I went on, because due to my traumas, like even when I got HIV diagnosed in 2000, that was a huge trauma for me. And I didn't really, it was a secret for about 10 years. I didn't reach out to anybody. And every time I went to the doctors and I said, go on your meds, you need to go on your meds, it was just a constant reminder, oh yeah, I have HIV, right? And then, you know, personal losses too, the stigma. I mean, stigma being an Indigenous woman also, being a single mom, and along with the HIV. Discrimination with my family, lost a lot of friends too due to my HIV. And there's homelessness, job loss, PTSD, depression. When I was incarcerated, I was outed right by the prison system too, in there with my medications, in front of other inmates. Physical violence in my life. When my partner found out I was HIV positive, the relationship went to more violence. And sexual violence and child apprehension and emotional and verbal abuse. So it was around 2011, 2012 is when I started going out and seeking out counseling and support for these traumas. And so I started finding supportive housing. I was homeless for quite a few years, and I finally got into a shelter and then moved into second stage housing and then into a recovery house for about 6 months. I started getting addiction support with counselors and also getting involved with the HIV community was probably the biggest step for me. For living with it in a secret from 2000 till about 2012 when I actually went to AIDS Vancouver, and I went in there and asked to volunteer in their grocery program. And then I was like, wow, I saw all my peers coming all of a sudden. I could say, I'm not alone here, and made so many good friendships, lots of laughter. It was a huge break in the stigma that I was internalizing myself. Also the helping others and my regular physician, seeing her every 3 months was a huge step. And she got to know me too, like we built more of a personal relationship. I first saw Julio for about 7 years, and then he basically had to give me a kick in the butt and give me a female doctor. And when I saw her, she actually says, Flo, I just want you to try your ARVs just for 6 months. I said, 6 months? Okay, I can do that. And I did it for 6 months, and of course I became my CD4 went up, viral load was undetectable, and I'm like, hey, I'm done now, right? She goes, no, you gotta do it for the rest of your life. And I was kind of like, But, you know, those little steps and stuff and getting the supports I needed, even from AIDS service organizations, and being at the grocery, I got to see job postings. My first one was for the Dr. Peters Center, where that was my first job as a peer researcher. And it was awesome, and I got to know a new community there too, and which helped me get into HIV-specific housing too. So from that point on, you know, I learned to basically try and be friends with my medications after dealing with so many of these things. And some of these traumas still come up. There's triggers, don't get me wrong and stuff. But today I can actually recognize them and see them, and I do know where to get the support that I need to, right, in order to stay healthy. So obviously trauma negatively affects the person's mental, physical, social, emotional, and spiritual health. So trauma-informed care is so needed to support adherence to our ARVs and responses to structural vulnerabilities that expose women to traumas such as incarceration, unstable housing, and like you were saying from my slide before that, in regards to my not adhering to it due to a lot of these traumas. This needs to be with all HIV care providers or GPs and stuff for them to bring this trauma-informed care to all women living with HIV. Yeah, so I think I'm going to pass this on to Andrea now.
Well, thank you, Flo. Yep. I'm going to talk a little bit about some of the findings from the SHAWNA study around incarceration. And the study I'm going to talk about first is a study that was led by one of our PhD students, who's also in the room today, Margaret Erickson. So what we found is that women living with HIV experience extremely high rates of criminalization and incarceration. So among SHAWNA participants, 76% of participants have been incarcerated over their lifetime, and 17% have been incarcerated over the past 6 months. So these numbers really show a high over-criminalization of women living with HIV. And for this study, we were interested to better understand what are some of the factors that put women living with HIV at risk for incarceration. And what we found is that younger age, recent opioid use, experience of recent gender-based violence, homelessness, and experiences of police violence were all associated with recent incarceration. So these findings really highlight, and women living with HIV who have experienced physical and sexual violence were twice as likely to experience incarceration. So these findings really show how incarceration and criminalization are really closely tied in with various social and structural, gendered social and structural factors, including experiencing recent gender-based violence. So in a separate study, also led by Margaret Erickson, we found that incarceration was one of the primary factors that was associated with not being able to achieve viral suppression. So SHAWNA participants who had experienced incarceration were 3 times more likely to have an unsuppressed viral load. So this is a really key finding, really showing how incarceration has a negative effect on the health outcomes of women living with HIV. So the beauty of having like a quantitative cohort and also some qualitative work that runs alongside it is really, so now the next step for us currently, and Flo has done, I guess, 19 interviews so far, we really want to use qualitative methods to get participants' voices and their experience to really understand like the incarceration trajectories that women go through. So we're currently doing these interviews and we're asking questions around what was going on in your life at the time when you were arrested, to kind of understand like more qualitatively those factors that are associated with incarceration. We also ask questions about being transferred between pretrial facilities, city cells, different institutions, as well as women's experiences while they're incarcerated. We're currently working on an analysis also looking at stigma within prison settings, both looking at stigma that is perpetrated sort of on a systemic level at the institutional level as well through prison guards and things like that, but also like just looking at sort of the day-to-day stigma that women face in terms of, oh, what are you taking these meds for? Things like that. So, and then importantly also, we're asking women about what happened right after you were released from prison? What were some of the things you really needed? And what were some of the things you didn't have? What kind of supports could have helped you to connect, to find housings? What were your priorities, pretty much? So it's really nice example of seeing how we can use quantitative work and qualitative work to really go hand in hand together to kind of inform each other as well. So this is ongoing work, and I think it's really timely work as well, because as many of you know, in October 2017, the Provincial Health Services Authority has taken over responsibility for prison healthcare provision. So it's a really crucial time right now to come up, to get women's perspectives and experiences around incarceration trajectories to hopefully be able to inform policies and to inform service provision as well that supports women and helps to ameliorate some of the negative effects of criminalization as well as of incarceration. And I just also want to add, and that's something Flo mentioned to me while we were practicing, is really important to highlight, women living with HIV are predominantly incarcerated for non-violent offenses. They're incarcerated for petty crime like shoplifting or low-level drug trade. So it's really important to also keep that in mind in terms of like systemic levels that have a direct impact on women living with HIV's health. So in another study that was led by Daniela Barreto, we looked at sort of the cyclical nature of HIV stigma, violence, and non-consensual disclosure of women's HIV status. So 44% of SHAWNA participants have experienced violence due to their HIV status. So Lulu has told us earlier that a really high 97% of women living with HIV within SHAWNA have experienced stigma related to their HIV status. And I just want us to let that sink in, like pretty much everybody in that study has experienced HIV-related stigma. And now here we see that among those participants, 44 have experienced violence related to their HIV status, and 52% of participants disclosed that they had their HIV status disclosed without consent. So more than half of the women have gone through this experience where their HIV status was disclosed by someone without their consent. And this, again, was directly linked. So SHAWNA participants who had their HIV status disclosed against their will were 5 times more likely to face HIV-related violence. So this really highlights how all of these factors are very closely connected. And we're doing some additional work right now in terms of looking at what is the context of where women's status was disclosed. So what we know just from talking to many women living with HIV and from consulting with our Positive Women's Advisory Board and with our peer researcher team, you know, women's status gets disclosed against their will, sometimes in healthcare settings. So we really need to look into that more and also have some really clear recommendations on how to avoid this from happening and protect the privacy of women living with HIV. It also happens in the context of social service provision, in the context of, for example, housing, supportive housing, and it can also happen in the context of personal relationships and also in the context of sexual relationships. And this is where all of this becomes even more sinister in a sense that in Canada, HIV non-disclosure to a sexual partner is actually criminalized. So I think many of you know that Canada has a very assertive approach to regulating HIV non-disclosure in the context of sexual relationships. So using a condom or having a low viral load is not sufficient to exclude criminal liability for not disclosing one's HIV status to a sex partner. So what that means is for people living with HIV, they have to disclose their HIV status unless they use a condom and have a suppressed viral load. So, and this is the case despite well-established science that antiretroviral therapy dramatically reduces the risk of HIV transmission, and really a growing body of evidence that shows that the criminal law is a really ineffective tool in terms of how to govern and prevent HIV transmission. So despite frequently being portrayed as a law that protects women, there's increasing evidence that shows that the negative effects of criminalization on cis and trans women living with HIV. We did a qualitative study a little while ago, looking at the gendered effects of the criminalization of HIV non-disclosure. So HIV disclosure can really shift, and this needs to all be understood in what we just talked about, like these high rates of experience of HIV-related stigma, high rates of violence against women living with HIV, right? So HIV disclosure can shift the power dynamics in relationships by aggravating partner abuse and manipulation. Even after disclosure, for many women, fear of legal consequences because their partner may threaten to file a non-disclosure report with police and use it as a form of intimidation, right? So women also told us that in the context of sexual assault, there's always also this fear about, wait, if I go and report this sexual assault to police, are there going to be charges coming back at me for non-disclosure? So I'm just going to read a few, if I can, because my eyes are not the youngest anymore either. I'm just going to read a few abbreviated quotes from some of the participants. So you can't get into a relationship without fear of going to jail. Women live in fear. You stay in relationships because you're afraid that that person will report you. I've been raped recently. I didn't report it. I just couldn't. Halfway through, he just asked, "Are you positive?" How do you answer that? And just briefly, because I just noticed the time as well. So gender power imbalances also affect the negotiation of condom use in heterosexual relationships. And in many ways, like the current law puts a disproportionate legal burden on women because they are not, like, aside from physically providing a condom and asking for it to be used, they can't really, put it on themselves. And this was, one of our participants summarized this way more eloquently than me. So I try to insist on condom use, but for most men, it ends up in an argument. So you don't trust me? Are you saying that I have something else? So you just end up going, okay, even though you know it's not, but I tried. So when this backfires, you couldn't come back. You don't come back and bite me. So this really summarizes like the fears that women have around the current state of the law. So we were really interested in looking at this in a bit more detail using arts-based methods. And Flo and Lulu are going to talk a little bit about that process.
Thanks, Andrea. So we did 5 groups of photo voice. And why we chose to do arts-based photo voice is because a lot of the talking about HIV and stigma, talking about criminalization of HIV non-disclosure is such a sensitive topic even for myself to talk about. So when we actually got our groups together, it helps people, anything actually visual or arts-based and stuff just helps you to kind of, I guess, bring out those traumas actually from dealing with all of that. And when these groups that we got to, they got to narrate their own work and how they're feeling around stigma and criminalization of HIV. We can also, from me being a co-facilitator, I got trained in the first pilot project, and then I got to do 3 other projects to help co-facilitate, as well as Lulu. We I guess I'm really close, a little biased to the Indigenous group we did. And that one, we had 8 women from that group, and we had to actually go and recruit women from existing support groups. So it had to be a group that was already comfortable being together. And another group that we did was thanks to Patience Magugula and the Afro-Canadian and Black Net, where she helped recruit a group of women for that group itself too. Also, Sarah Chone helped us recruit for the YouthCO. So we had a group on youth. And our Positive Women's Advisory Board was the first pilot project because that group had already been existing as we met quarterly for a couple of years. And Lulu's going to talk a little bit more in regards to the trans group. So basically, we did 5 to 6 sessions. So basically on the first session, we would do a PowerPoint project, letting the women know what the law is today around HIV disclosure and non-disclosure. And surprising enough, in these groups, there was a lot of women, like, it brought up so much fear because they didn't even know, right? And I could read that. And these women coming together in the first group, whether like I'll speak to like the Indigenous group, where a lot of them didn't know each other because they were from two different groups. And on our first group, we would do the PowerPoint. And the Indigenous group, we were really fortunate to have it opened by Elder Roberta Price. So she was actually present out of 4 out of the 6 for the Indigenous, which made the women feel a lot better too. And we also had a smudge in the beginning, a smudge in the end, and any kind of one-on-one support that the women needed. And on that first day, we would finish off, we had pre-cut images that were specific to each group, whether it was Indigenous or ACP-Net, or whether it was for youth and stuff. And so they would make a collage on a poster board in regards to stigma and criminalization of HIV. There was lots of like bars and stuff. We're gonna show you, like, this is actually the collages that we put together from some of the women where they did. So this kind of got the juices flowing for them in regards to, because the next part was the photo voice. So after they did their collages and then they did the narrations, the next group that came, we would give them a camera and give them kind of instructions how to do digital camera using in that, how they couldn't actually ethically, they couldn't take any faces or anybody that could be recognizable. And the women got the cameras for about a week, sometimes 2 weeks, and then they brought them back, and we'd get the images done, and then we met again, and the women would actually pick their top 3 or 4 photos that they wanted, and then they would narrate towards those photos. And part of the narrations, you know, we got to get them transcribed, bring them back to the women from what they can see what they actually were saying on the audio recorder, and they got to actually edit that too. Oh no, I don't want that in there. I'd like this in there. So it was truly just, they were in charge of the whole project themselves and what we actually brought out to the photo voice. And then in closing and stuff, they got to keep the digital camera, obviously, and they were also honored with an honorarium for each group, nice hot meal, and everything was just appropriate to which group was going on. And so we have 27 photos, right? Yeah, 27 photos out of the 5 groups. And I'm going to let Lulu take over here because I see the time too, and she can actually run you through some of the photos and the narrations.
Thank you so much, Flo. Just before I get started on letting you know, or show you the pictures that we have gathered from the Photo Voice Project, I would also like to let you guys know that all of the names that you see on any of these photos, these are pseudonyms to further protect their confidentiality and also their stories. So I'm just going to jump right into this. So Niki took a picture of a dying tree, and this is what she told us about the photograph. In this photo, the tree's branches are lifeless, hanging in despair as if it was hopelessly surrendered its life to the elements. Some trees can live up to 1,000 years, yet in this picture, the life of the tree has been stolen. The threat of criminalization of non-disclosure has stolen my life as I knew it, as I would like it to be. I live in fear and despair, and I've put walls up around me, and there is a constant threat hanging over me, even if I dare to experience the things that bring me joy, the things I have a right to, things that others take for granted. And as most of the participants have shared as well, because they're living with HIV, they can't be in a relationship because of the fear that they face of being rejected when approaching a relationship. And for the next photo, we have A, who is part of the Indigenous Group. She has highlighted how living in a building for people living with HIV contributed to the outing her status to people she was not prepared to disclose to. And this is what A had said about her photo. My residency was listed as a place for people with HIV only, so me living there meant that I had it. Regardless, for people like some of my family members that maybe I had not disclosed to, that caused a very, very big controversy in the family. Also, for entering and leaving these places, I think it has caused a lot of problems. You know, being listed as a building for people living with HIV People are going to be labeled and whatnot. And it should not have to be like that. So even having a stable home for A to be living in still feels like it's not private or protected in any way. So for the following picture, for C, who is part of the youth group, C had taken a picture of gloves, and this is what she had to say about her picture. I took a picture of gloves because when I moved back home, HIV positive, my parents kept gloves in the hall closet because they thought that if I got cut, they would need it to help me with gloves on. And it really hurt. They also told me not to get my razor confused with theirs. Many nights, I would just sit at Tim Hortons or McDonald's in the bathroom and use drugs. Just very lonely and dealing with a lot of things. I've been discriminated against a lot around bathroom usage, and I feel very hurt when I've been asked to bleach the shower after I use it. So what is happening, and through C's narration, she's really talking about the experience of isolation, even through family and friends, and just not being able to be herself, even in her own home. So for Kaya, who was part of the trans group, took a picture in front of the Vancouver courts. And as you can see up here, it is HIV that is spelled out with shoes. And this is what Kaya had said about the photos. Spelling out the word HIV with shoes, that in itself is a huge, huge message. Because the way I look at it, it doesn't matter who we are or what we are. We all walk the same little path. As a non-binary person, I didn't know how else to capture a non-binary individual. The only way I could do it was by shoes. It's a 12-year journey of having to live with the virus that I so much wish I could just get rid of. Becoming HIV positive has been one of those things I regret. Saying that, I also wouldn't be here, be where I am today if it wasn't because of being HIV positive. So for Kaya, using the various types of shoes to spell out HIV to help her show how difficult it is for her to even show or be able to share a message in regards to being HIV positive and facing, HIV non-disclosure as well. This is where I'm finished, and I'm going to be passing it off to Flo, right? Thank you.
Oh, yeah, for sure. Okay. So thank you, Lulu, for that. Yes. I just wanted to mention too, like with Lulu, she, because there's no existing group for trans or binary, so she actually did one-on-ones for that specific group. Thank you. You're welcome. You do it for me too. So these are some of the closing thoughts from our participants. And I'm just going to read a couple of them. I know you guys can read them too. Like, this is what they wanted to leave after the 6-week group, and they wanted what they wanted to take away. What I wanted to leave here is my shame and my guilt, and what I want to take away is all the love and caring and support I get from the ladies here. And what I want to leave here is the hurt and pain, and what I want to take with me is the security I found here. This past couple of hours, just as like, this is magic. Thank you. So a lot of these women were like, on our evaluations forms, they go, we need a weekly group like this, for that support each time. And this was just after 6 weeks. Are you next, Andrea? I'm next again. So, you guys have seen the pictures, the photos, and the narrations, right? And the link between the stigma and criminalization. Such a sensitive topic. And these women, what I can say from one group, and then when we did our photo exhibition where we showed all the photos in September of last year, we had some of these participants come there and be supportive and be proud to be by their picture and their narration. And as public came in or whoever came in to see the photos and stuff, some of them were showing them, this is my photo. So like you can see how some of that stigma is already breaking for a lot of them. And some of them became peer workers too in the downtown east side from some of the groups. Like, and that just blows my mind. Or even just to say hi to them, and they got empowered by this short 6 weeks, right? Which is awesome. That's it.
And I'm just going to keep this super short because I know you guys are on lunch and also want to leave just a few minutes for questions. But I just want to say briefly, there's a little bit of a silver lining. In December 2017, the former Attorney General of Canada, Jody Wilson-Raybould, put out a report and really clearly stating that HIV non-disclosure should be treated as a public health issue and not as, as a criminal issue. So that was a big deal because there's been so much advocacy going on over the years in Canada by many people in the room and also the Canadian HIV Legal Network and various other groups. So, and just briefly on this, various provinces since have put in prosecutorial guidelines to kind of limit the prosecution of people living with HIV. And most recently, this past World AIDS Day, the Attorney General, Jody Wilson-Raybould, has put in a federal directive to say that there should be no criminal prosecutions of people living with HIV if they've maintained a suppressed viral load, used the condom, engaged in oral sex only, or were taking their medications as prescribed. So this is actually a really big deal. Unfortunately, this is only binding currently in the 3 territories, so Nunavut, Yukon, and the Northwest Territories. Right now, we're working really hard and want to use this research and some research that we have here, but that I can't get into right now because I want to save some time for questions. But we're really advocating for the implementation of these federal guidelines also at the provincial levels. So this is the next big step that needs to happen, and it's really important for this to happen to protect the most marginalized people living with HIV. And so, yes, we put in a policy brief to David Eby, the Attorney General of BC. Our community partner, the Canadian HIV Legal Network, did the same, really urging David Eby and the provincial government of BC to follow suit. And yes, and there has been years and years of advocacy going into that. So there is a silver lining. I'm very hopeful that the provinces will follow suit very soon for the federal directive issued by Jody Wilson-Raybould. And so this work wouldn't be possible without our participants who generously share very personal information with us. And we're really honored that they trust us with their information and that we're using it in a way that they feel comfortable with. We also want to thank all our community partners, some of whom are in the room, including ACPNet patients. You really, it's amazing working together. And then finally, I also want to acknowledge the principal investigator of this study, Dr. Kate Shannon, who is also here, for making all of this possible and starting something really amazing for all of us. So yes, and I also want to thank all the people that work on the background on the administrative side. Lots of them are in the room here too, Megan and Colette, for helping us with this work, and the frontline workers as well, who do all the interviews on the cohort side of things. So thank you. And yes, hopefully there's a bit of time for questions. Sorry, I got carried away with the thank yous.